This is the 10th in a series of videos about the business of the eyecare service. Module 10, Planning Outreach, Part 2 of 2. The learning objectives in this module are knowing the steps involved in planning outreach, to be able to select, advise, and recognise suitable sponsors and volunteers, to understand the costs of financing outreach, and how, why, and when to publicise outreach for maximum effect. Predicting the size of the event. Generally, unless targeting specific groups, outreach events try to attract as many people in a selected area as possible. The size of the targeted population will help in predicting expected turnout. If a new hospital conducts an outreach event in an unfamiliar location, 1 to 2% of the population can be predicted to attend the event, provided the publicity campaign effectively reaches the target villages. Factors that impact event turnout include 1. Demographics. The population size in the targeted radius, breakdown of population by age, if there is high prevalence of eye disease in the district, and the density of the population. 2. Publicity campaign. You should achieve in-depth coverage within an accessible radius and make your venue accessible. How good is the local community partners' dedicated campaign reach, and what is the impact of their publicity? How many people were reached, and how many responded with enthusiasm? The impact of other educational campaigns on eye health, and the impact of past outreach events in the same location or nearby with previous patient satisfaction will determine word-of-mouth publicity. People and places you can approach as potential sponsors include service clubs, for example Lions, Rotary, prominent employers such as factories, industries, businesses or corporate offices, cooperative societies or banks, religious and youth organisations, charitable groups, trust associations, schools, colleges, voluntary agencies, local hospitals, healthcare centres and traditional healers, handicapped welfare associations, recreational clubs, local municipalities, political parties or politicians, village leaders, and of course philanthropists. Inviting sponsors to work with the eyecare institution at the local level is an effective way of reaching large numbers of rural patients while keeping outreach costs as low as possible. The local sponsor contributes time, energy, and local knowledge to publicity efforts, selecting a venue, and arranging hospitality and accommodation if necessary. Get to know the sponsor and cultivate a friendly relationship. Sponsors are usually rooted in the local community. Outreach organisers are responsible for providing sponsors with written guidelines on what is expected of them regarding such things as publicity, hospitality, and site preparation. Sponsors and outreach organisers exchange official letters of understanding and confirmation before collaborating. Event organisers meet with each sponsor to establish a clear working relationship with well-defined mutual expectations. When convincing sponsors to help, some key elements to highlight are the high standing and reputation of the service and staff, statistics on eye care needs in the location so that the sponsor understands why this location was selected, the simplicity and affordability of care, including glasses, direct benefits to the sponsor, such as good publicity or exposure in the region, their boosted reputation, and their good standing with regional authorities. You should report good outreach experiences in that community in the past and need to repeat to serve the remaining community. So how do we select a sponsor? Well, we can start by asking, is the sponsor committed to community service? The sponsor should be respected and have a good rapport with the local community. Preferably, the sponsor will have a background in community involvement. Is the sponsor willing to collaborate and cooperate with others? Sponsors must be willing to take guidance from the eye care institution's outreach staff, especially the outreach organiser. An organiser checklist for dealing with sponsors might look like the following. Agree outreach organisation procedures, venue, date and time. Report to the outreach team providing the above information. Send a letter of confirmation and a detailed outreach plan with a list of specific requirements for the sponsor to complete. Send the sponsor an illustration of patient flow and required space and a list of required furniture and volunteers. Visit the site to see pre-event arrangements and to guide the sponsor in finalising them. And liaise constantly with the sponsor. And things for the sponsor to do include, after the meeting with an outreach organiser, send the hospital a letter of confirmation. Publicise the event widely to attract as many patients as possible. Arrange for a venue with suitable amenities, water, electricity, furniture, toilets, etc. Provide food and accommodation, if necessary, to the hospital team. And gather volunteers, either to receive training to assist the outreach team directly, or to help prepare and clean up the outreach site, arrange furniture, set up outreach equipment, etc. We must always recognise the valued help of our sponsors. Some ways to do this include honours and congratulations at hospital and public events, at meetings, or in person. Letters of thanks and appreciation. Follow-up reports with statistics, pictures, and overall evaluations. Media coverage of the good deeds they made possible. Occasional visits to sponsors, or staying in touch by telephone. Or maybe even separate Sponsors Day event at the base hospital to recognise their contribution. maybe every 1 to 2 years, to sustain sponsor interest. The local community have an important role to play in the success of an outreach event. The sponsor should identify and work with other service-minded people or organisations in their community. Fully engaging the community can help reduce the cost of publicity and ensure a good turnout. Village leaders and local politicians can persuade patients to attend and volunteers to help out. Local doctors tell people with eye problems to attend. Teachers can ask students to identify potential patients in their family. And religious leaders can talk about the importance of attending. As always, monitoring and evaluation of outreach events is essential. Outreach teams must hold regular meetings to discuss results of outreach clinics and to ensure accountability and continuous improvement. When considering the financing of outreach, organisers and sponsors need to ensure community and volunteer involvement, which will reduce expenses while still getting a good turnout of patients. Conducting outreach successfully can mean incurring sizable expense. The main costs in conducting an outreach event are publicity, hospitality for the hospital team, transport to and from the location for the outreach team, any expenses of volunteers, and miscellaneous costs. Always include a contingency budget for unforeseen expenses. So publicity costs should be considered as follows. Number of posters printed times the cost per poster plus the distribution cost. Number of handbills printed times the cost per 1,000 handbills plus the distribution cost. Number of banners times the cost per banner plus the distribution cost. Number of vehicles rented times the cost per vehicle plus the audio equipment and production cost plus payment to announcers for audio announcements, etc. There may also be clinical team hospitality costs, such as lunch and refreshments for the outreach team on the day of the event, and the cost of accommodation if the team must stay overnight. The costs of volunteers includes the number of volunteers times the cost of hospitality per person during their pre-event publicity and other preparatory work. The cost of facility rental depends on if the venue is free or donated. Sometimes the owner of the facility is motivated to participate in the service activity by providing the venue at no cost. Be as cost conscious as much as possible. For example, the quality of posters is decided depending on resources available. Events can be conducted on a weekend. School buildings are usually available on weekends at low or no cost, and clinical staff are relatively free of hospital work on those days. The event organiser should monitor and advise the sponsors so that no money is spent unnecessarily on such things as elaborate inaugural functions or gifts, etc. Outreach is an important part of the marketing strategy for increasing an eye care institution's patient volume. But if the events themselves are not well publicised, this strategy will fail. Successful publicity is planned ahead of time by the organiser and typically implemented 3 to 7 days before the event. This time frame might differ in different cultures or settings. Publicity can include sponsors' name and logo and contact information. This is in addition to the goodwill and good reputation they will receive for their philanthropic contribution to the event. Publicity is a means of generating demand for events. High patient turnover maximizes the benefits, efficiencies, and cost effectiveness of community outreach initiatives. And publicity creates health awareness in a community and therefore is an end unto itself. So, what media are used to publicise outreach? There is print and visual media, including letters to village development committees, schools, health posts, etc. There's handbills, wall posters, cloth banners, newspaper advertisements, and publicity boards. There's also audio-visual media with public address announcements on foot or from moving vehicles, radio advertisements, word-of-mouth publicity spread by influential locals, social media, email and text messages using mobile phones. And there is the referral network. So we can request nearby major schools to announce the outreach details so that the students can ask their parents to attend the event. We can request village leaders and religious leaders to spread the message. We can request other sponsors who have conducted events in the same area to refer people who would benefit from the event. We can communicate with beneficiaries of previous events, requesting that they come to the next event and refer or bring their neighbours. In order to best ensure the full effect of publicity, you should specify the event date, place, and time very clearly. Include the name and/or logo of the sponsor and the eyecare institution. Distribute your flyers, your printed notices, at the same time as audio announcements and where people meet in large numbers. Place posters at important street junctions, village information boards, social or religious gathering places, near marketplaces, etc. Hang banners over major transport routes 3 to 7 days before the event. Pre-record audio announcements to ensure their audibility, clarity, and consistency, and include clear date, place, and time. What area should be covered? Try to reach every village and hamlet within a 3 to 5 kilometre radius of the event. A good publicity campaign can reach 8,000 to 25,000 people. How far in advance should an outreach be publicised? Well, start at least 2 to 3 days before the scheduled date for a small event, but 1 week or more for medium and large events. Publicity efforts should increase 2 days before the event to remind people. Again, these suggestions need to be adapted in different regions and cultures. The final 3 slides in this presentation Give examples of the wording of different letters that you should consider sending when organising outreach. The first is a proposal to conduct an outreach event. The second is a letter announcing the event and encouraging attendance. And the third is an example letter to express gratitude to sponsors or community partners for their contribution. That concludes Module 10 on Planning Outreach Part 2. Coming next is Module 11 on Safeguarding and Protecting Children and Adults at Risk.